Let's take a quick look at this question about acetylcholinergic activity. The question states that increased parasympathetic nervous system activity leads to increased acetylcholinergic activity, which makes sense because acetylcholine is the principal neurotransmitter of the parasympathetic nervous system. Which of the following effects is not associated with an increase in acetylcholine activity at receptors? So there's a really great explanation down here that Kaplan has provided, which is totally available if you want to pause the video and read it. But what I'd like to do is sort of use our MCAT undergraduate level understanding of sympathetic parasympathetic and apply it and see if we can use that to understand what's going on here. So let's just work through the answer choices, A through E, and apply that old mnemonic of rest and digest and fight or flight for the sympathetic nervous system. So number one is bradycardia. Brady means slow and cardia means heart. It's referring to the heart. So slow heart means slow heart rate. And if you're resting and digesting, that makes sense why bradycardia is definitely going to be an effect of parasympathetic nervous system activity. Just so happens the vagus nerve plays a large role in that. Then we have bronchoconstriction. If we think about it, if you're running and you're running away from a bear or whatever, and your sympathetic activity is revved up, you're probably going to bronchodilate so that you can get more air into your lungs and more oxygen to fuel your laboring muscles. The opposite of that, rest and digest, is going to be bronchoconstriction. And so just with that mnemonic, we've already eliminated two of these answer choices. We'll come back to C, because I messed it up and I put C. Then we have D, incontinence. Well, if you were running from a bear, you probably don't want to be urinating at the same time. So the sympathetic nervous system is actually going to keep you from urinating, whereas the rest and digest parasympathetic nervous system is going to increase those muscarinic acetylcholine receptors at the bladder and increase urine release. But again, that makes sense in the context of rest and digest. That makes a whole lot of sense why the parasympathetic nervous system is going to have that effect. Then we look at C, diarrhea. This is a bit of a, we kind of have to think about it. Rest and digest means move food through the gut. That's digest. So parasympathetic activity is going to increase the movement of stuff through the gut. And if you have a hyperactive parasympathetic nervous system or a drug that's mimicking acetylcholine activity, it makes sense that that motility will go up, leading an increased output, which we would call diarrhea, which is why C is an incorrect answer choice, because that would result from excessive acetylcholinergic activity. Finally, mydriasis. Mydriasis is the opposite of meiosis. Meiosis means constricted, tiny little pupils, and mydriasis means big, blown-up eyes. And you can think of meiosis as a small word, mydriasis is a big word, so it's easy to remember that pairing. If you were running from a bear, if you were getting mugged in the middle of the night or something, you would really want your pupils to blow up and let all of that light in so that you could see what's going on. In contrast, if you're chilling out, you're resting, you're digesting, you don't have the necessity to see all of that stuff, your pupils would become relatively constricted, which would be meiosis in the parasympathetic setting. So in this case, the correct answer is E, because increased parasympathetic or acetylcholinergic activity would not lead to mydriasis, it would lead to meiosis. So we select the answer choice E and move on.